Hi, my name is Taylor and I'm a dental hygienist here at Advanced Family Smiles in Northeast Philadelphia. Today we're going to talk about the iTero scanner. So the iTero scanner is something that we use in the office, both in hygiene and in the doctor's visits. For hygiene, mostly we do this to create a baseline for the patient. We call it a healthy mouth scan. So if we do this once a year, once every 6 months, we can track what's going on in the patient's mouth and show them so that they're better able to understand what's going on and what we're talking about because they're able to visualize it. So this is a patient that we took a scan for, and we can see his whole mouth here on the scanner in a 3D image. So when we take a look at this, we can see multiple things. I can show the patient here there's occlusal wear, so he's most likely grinding and clenching his teeth, which would be a need for a night guard. Additionally, if we look on the outside of the teeth or the buccal surface of the teeth, we see a lot of recession going on. This is also from clenching and grinding, and a night guard could help prevent this because when we have recession, that piece of the tooth is not covered by enamel, it's a lot more porous, and people have a lot of sensitivity with that. When we look at the front here, we can see a lot of crowding going on. Now we do offer Invisalign in the office, so this would be another great option. We can do an outcome simulator on this. This will show us what your teeth look like now, and if we were to do Invisalign, how they would be corrected, so you can see what the end goal would be. Obviously for this patient, we don't want to keep the crowding like this because one, he's not able to properly clean his teeth, and two, it can lead to more periodontal issues down the road because the teeth aren't in the correct occlusion. He might have trauma from his bite, things like that. Another feature that we have on here is something called the occlusogram. So when we look like this and it makes it colored, it shows us where we're putting the most force on our teeth. So we don't want to see any red because that means that too much force is getting bitten down in that area. Additionally, we also don't want to see a lot of blue because that means that the teeth aren't touching at all and they need to come into occlusion to properly chew your food. So we can see on here all different levels of bite force that we have, and honestly we do have a lot of blue. So the teeth aren't in proper occlusion, they're not coming together like they should, so this patient definitely would benefit from Invisalign. But the most valuable reason that we want to use this is to track patients' progress, keep an eye on teeth. If we do see a lot of recession, we can teach the patient about it. We can show them their progress over time. We can compare different scans from different years. And overall, it gives the patient a better understanding of what's going on in the office.